Week 5 of 40 Weeks with Dr. Martin is all about exactly what you're probably feeling right now if you are 5 weeks pregnant. Early pregnancy signs. Welcome to week 5 of 40 Weeks with Dr. Martin. Now, hopefully this week you've gotten your positive pregnancy test, and congratulations. If you're still trying to figure out when to take your pregnancy test, check out week 4 of 40 Weeks with Dr. Martin, where we dive into exactly when you can take a pregnancy test. Now, this week, hopefully you've peed on your stick, you've gotten your positive test, and now you're just starting to feel some early pregnancy symptoms. And that is exactly what we will cover today. I'm Dr. Eva Martin. I graduated from Harvard Medical School and trained in OBGYN. I am passionate about giving you honest, straightforward answers to all your pregnancy questions here on 40 Weeks with Dr. Martin. This week we'll cover 5 common symptoms of early pregnancy and exactly why those things occur. We're going to dive right into what is perhaps, at least on TV, the most common symptom of early pregnancy, which is nausea. I don't think I've ever seen a TV show that had a pregnant woman that wasn't pictured bent over a toilet, losing her lunch. We'll dive into the nitty-gritty of morning sickness treatments later in another video, but for today we'll dip our toe into exactly why you might experience this when you are first pregnant. For most women, nausea is the worst in the first trimester. It usually starts between 4 to 8 weeks of gestation. Although we call it morning sickness, any pregnant woman can tell you this is a myth. The symptoms are just as likely to strike any time of the day. The exact cause of nausea and vomiting in pregnancy is not definitively known, but it is believed to be linked to HCG, the pregnancy hormone. We took a deep look at HCG in week 4, since that's the hormone produced by the placenta that is detected by pregnancy tests. Women with higher levels of HCG tend to have more nausea, and nausea symptoms peak at the same time as HCG levels. Another theory is that estrogen, another hormone that rises during pregnancy, is the cause. Now, if you are experiencing morning sickness, you probably have a lot more questions that I haven't even close to covered. Never fear, I'll do a whole video just on morning sickness. For now, let's go to pregnancy sign number 2, sore breasts. Now, this symptom can really trick you if you're not sure if you're pregnant or not. Most women get sore breasts before their period, but it can also be a sign of early pregnancy. Many women describe the sense of soreness or tingling in their breasts as the same as they usually feel before their period starts, but more intense when they're pregnant. Like nausea, it typically starts around 4 to 7 weeks of pregnancy and is most intense in the first trimester. During pregnancy, your breasts will most likely increase in size. This is due to more blood flow going to your breasts as well as more fat depositing in your breasts, all getting ready for breastfeeding. But in the meantime, all of this growth can lead to quite a bit of tenderness and soreness. So what's behind these new giant boobies? The hormones estrogen and progesterone. In pregnancy, estrogen and progesterone levels rise, causing the ducts in the breast to fill with fluid and prepare for pregnancy. Other changes you might notice with your boobs is darkening of the areola, which is the area around the nipple. Many women also find that the blue veins in their breasts become more noticeable. As I mentioned, blood flow to the breasts is increasing after all. You may also notice that your nipples are protruding more than normal. Did anyone say padded bra? In all seriousness, a padded bra with an underwire is probably the least comfortable thing when your breasts are sore from pregnancy. Most women prefer a soft cotton bra like a sports bra or the built-in bras for a camisole that they find can be a little bit of support, can actually go a long way in decreasing how sore their breasts are. A lot of women even wear the cotton bra at night when they're sleeping. The third early pregnancy sign is fatigue. Again, the rush of new hormones, especially progesterone, that come with pregnancy are likely to blame, And again, the intense fatigue usually tapers by the second trimester. During pregnancy, your body undergoes an unbelievable number of changes so that it can grow another human. Amazingly, your blood volume increases by 50%. You use up more oxygen, and your heart rate speeds up by 10 to 20 beats per minute. With all these changes and new strains on your body, it's no wonder you're tired. So, if you've fallen asleep in the middle of this video, I forgive you. It's not my video, it's the pregnancy. Now, let's move on to 2 more pregnancy signs before you fall back asleep. 70% of pregnant women experience shortness of breath or dyspnea during their pregnancies, even during normal daily activities. You might have assumed that women's shortness of breath during pregnancy is due to a pregnant belly pushing up on the lungs and giving them less space to get a full breath of air. But this actually isn't the only cause, because women in pregnancy start experiencing shortness of breath way before the uterus is anywhere near the lungs. During pregnancy, your lungs are now responsible for oxygenating yourself and your growing baby. The amount of air you breathe every minute increases by up to 48%. The amount of oxygen you use up every minute increases by 21%. And your baseline metabolic rate increases by 14%. Once again, we can thank progesterone. Progesterone makes the body's respiratory command center more sensitive to carbon dioxide. You can think of carbon dioxide as oxygen's opposite. You breathe in oxygen to fuel your muscles, and you breathe out carbon dioxide as a waste product. High carbon dioxide triggers the body to seek out more oxygen by taking more breaths or deeper breaths, for instance. So, when progesterone makes your body's respiratory thermostat more sensitive to carbon dioxide, it makes it hungrier for oxygen. If it seems complicated, it is. If you followed all of that, congrats! You just passed week 1 of medical school respiratory physiology. Progesterone can also interact with the muscles in your airways to make them dilate or open up. And finally, progesterone even interacts with your mucous membranes, which could give you a feeling of nasal congestion. You've probably noticed I've been talking about progesterone a whole lot today. And that's because progesterone is the major pregnancy hormone. The easiest way to remember this is all in the name. Progesterone. Progestational, or pregnancy hormone. Progesterone. Our final early pregnancy sign is mood swings. Just like before your period, and like all the other signs, we're going to blame this one on the hormones, especially estrogen and progesterone. Some women report that they feel more emotional. Others, that they are annoyed more easily. Whatever you are feeling, just embrace it. You are awesome. I hesitated to include this one because there is nothing I hate more than when my husband points out that I might be PMSing when I get a little cranky. I would hate to give fuel to the fire to anyone who wants to harass my dear pregnant viewers who might be feeling a little moody. In fact, if anyone asks, Dr. Martin says you were right about that thing you were just arguing about earlier. And also, you can't fold laundry anymore for the baby's sake. If you search online, you can find tons of additional early pregnancy signs, like cramping, bloating, headaches, back pain, constipation, dizziness, sensitivity to smells, and food cravings, to name a few. A lot of these symptoms overlap with those that you'll experience right before getting your period, and this is because the hormones that increase at that time are the same. The take-home message from this video is quite obviously, blame it on the hormones, especially progesterone. Now, what's going on in your body is absolutely amazing. You are transitioning from supporting one person to supporting and growing a whole nother person. It's an extraordinary time, and your body is doing extraordinary things. But that doesn't mean it doesn't come with its discomforts and symptoms. So, As you go along in the pregnancy, tune in to more videos from 40 Weeks with Dr. Martin, where I'll keep covering signs and symptoms that you might have during your pregnancy and get even more in depth with ways that you can cope with them or treat them. Didn't take notes fast enough for my clever infographics? You can find complete notes on my website, thepregnancydoc.com. There you can also find a list of references. Trust me, they're all from really legit sources like the CDC and ACOG. Thank you for watching week 5 of 40 Weeks with Dr. Martin. I hope you enjoyed talking about all of these early pregnancy signs and symptoms. I hope that if you are pregnant and you're experiencing these, they're not too severe. If you have more questions, please feel free to comment below. To keep up with all these great videos, subscribe to the channel. If you want to find me online, I'm at thepregnancydoc.com and I'm on Twitter at Dr. Eva Martin. Please note, nothing contained in this video is medical advice, just opinions and information. Please ask your doctor about everything and call her if something is wacky. Your situation is unique, so only your doctor can give you medical advice.